Hello, Medicare Advantage Risk Adjustment operators, innovators, and learners. Welcome to the last learning series of this month's episode, learning a lot about the Medicare Advantage supplemental benefits service categories. If today is your first time here, we want to say welcome. If you have been studying with us for the past weeks, we also want to say thank you and welcome. If you have not subscribed to our channel, I will gladly encourage you to subscribe, to like, to share with your friends who are in this space because it helps us to get to a wider audience and also make much more impact. As we have been discussing on the Medicare Advantage Supplemental Benefits Code, we have always started this month's learning from the February 21, 2024 HPMS memo that CMS communicated to the industry, especially to the health plans, of their intention to collect Medicare Advantage supplemental benefits data through the Encounter data system. Moreover, CMS also followed up with this August 22nd, 2024 HPMS memo informing the plans of CMS's readiness to collect these data and more especially the supplemental dental benefits data through the Encounter data processing system. We have been taking these supplemental benefits service category codes, and throughout this whole month, we have been dissecting them to understand the components, what they include, and looking at some of the top service category codes that are seen in the 90 plus supplemental benefits codes into higher level categories so that it's easier for you to work with. Our methodology this month has been taking the supplemental benefits category codes and categorizing them based on their leading numbers. And then we have grouped the leading numbers into themes based on the code descriptions, and we sorted them, and based on the number of codes we have been learning throughout this month. And this is our fifth week as we have been going that. If today's your first time joining us, I will gladly encourage you to look at the prior videos that are on this playlist, and also in the video notes you will see that they have been all listed down there for you to learn more about what we have covered over this past month. Based on the methodology that we've been working with this month, we came up with these supplemental benefits codes categories that we have covered over the month. The first video episode covered the preventative and wellness service codes, which had 28 different codes in them. Then the next week covered the non-medical and social support service codes, which had 22 different codes in them. And then we looked at the dental care services, which had 11 different codes in them. And last week we covered the inpatient care services and the vision care services, which had 7 codes in them each. And today we are looking at our fifth supplemental service category codes that takes on the number 5 or number 6, depending on how you're counting. So our fifth highest one, if you can also call it the sixth highest because the other one was a tie, is the supplemental benefits codes that starts with number 18. And those are the hearing care services supplemental benefits categories that are in the supplemental benefits codes that CMS shared. There are 6 different codes as you've been seeing because we've been doing a descending order, so the numbers are going down. There are 6 different codes that start with number 18 and therefore fall within the hearing care supplemental benefits. And these 6 codes can be grouped into 2 different broad categories that are routine hearing care services, which, for example, there is the 18A1, which is routine hearing exams, and also 18A2, which is fit-in evaluation for hearing aids. So these 2 can be categorized into routine hearing care services. And the next one is hearing aid services. And the hearing aid services, because there are only 6, so the 2 fall into hearing care services, the subsequent 4 also fall into the hearing aid services. And for example, there is a 18B1, which is hearing aids of all types, or 18B2, hearing aids for the inner ear, or 18B3, which is hearing aid for the outer ear, or the last one, which is 18B4, which is hearing aids over the ear. And therefore, as a health plan, if you're submitting data pertaining to these supplemental benefits, these are the codes that you want to leverage as beneficiaries utilize these supplemental benefits and you report them to CMS through the encounter data system. If you have any questions, don't hesitate to reach out to me at info@thehillsacademy.com. Please check out our website at www.thehillsacademy.com/resources, where you can download some free resources for your Medicare Advantage encounter data and risk adjustment operations or analytics. Also, I will encourage you, if you haven't done so already, to go to our website and download our signature gift, which is From Chaos to Clarity, the Essential Medicare Advantage Risk Adjustment Sources Comparison Cheat Sheet that compares the different data sources of risk adjustment for you for free. And as you do that, you also get the privilege to also being part of our growing email list so that you do not miss anything from us. If there are ways that you have recategorized these supplemental benefits codes, I would be very happy to know. And you can leave a comment down below in the video, and I will gladly want to learn about it. Otherwise, thank you again for joining us this month, and we'll look forward to seeing you starting a new episode next month. Bye for now.